Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Okay, we are back, and this is Healthy Living Tuesday right here on KUM News Extra, and we are not going to waste one moment, my friends out there in TV land, because Dr. Jitka Lom is here once again in the Harmon Studios. Doctor, so nice to see you.
Thank you.
All right, hopefully the bad weather of late hasn't affected yourself or your family or your patients.
We're hanging in there.
Okay, well, we can hope for that. Okay, so we have run the gamut of topics here on Healthy Living. We've talked about many different types of afflictions and injuries. Tonight we're talking about a topic that's a little bit uncomfortable and I would say maybe misunderstood. We're talking about warts. Mm-hmm. Okay, so from a medical and scientific standpoint, what exactly are warts?
Okay, warts are caused by the human papillomavirus, or HPV for short. There are about 150 different varieties of this virus. It is a very clever organism because once it lands on you, it can penetrate your skin if there's a small break in the skin, and then it creates an actual cluster of cells, or basically a nest, to camouflage itself. So it's basically hidden within your own skin, and your own body will not see it for some time. That's why warts last usually quite a while. Mm-hmm.
Now, in contrast to pimples and zits, which we talked about not a month ago, this is something that's actually bacteriological or viral. In nature, and it's not like a break in the skin and then dirt gets in and everything. And
no,
you can get some,
no,
okay.
It's a virus, and actually after the virus infects you and it's within your skin, it will incorporate itself into your actual DNA.
Oh, okay. And so after it gets under your skin, literally and figuratively,
yes.
What are some of the dangers, and what type of symptoms can one get from this, or do you just have like a really nasty bump for God knows how long?
It can be both. Warts can be just basically annoying and unsightly, but they can also be painful. They can bleed and they can get in the way, especially if they're on the tips of the fingernails or fingers where the nails are. Or actually, genital warts can be pretty unpleasant and uncomfortable for people. Okay,
we are going to talk about those later on because by their nature they are one of the more scary type of warts. So maybe again, compare and contrast, you already said, against some of the more dermatological types of marks you can get on the face. I'm searching for the word here.
Yeah.
What about boils and warts?
Okay, boils are different. Boils are caused by a bacterial infection. Bacteria are very large germs. Viruses are tiny little germs. Mm-hmm. Bacteria basically get through a break in the skin as well, but instead of causing the skin cells to pile up the way a wart is, it's just basically a piled up bunch of skin cells. Boils will be a collection of pus within the skin, and they'll be red and painful.
Okay, very well, or not very well, I guess I should say. Of course, what we like to do here on Healthy Living is help our beloved viewers out there by debunking myths.
Yes.
And probably the most common myth relative to warts and everything is, can you get warts from touching a frog or kissing a frog and maybe turn it into a prince?
Well, warts are caused by the human papillomavirus, so it has nothing to do with warts or toads. Toads and warts sometimes look bumpy or slimy. Those are glands and slime that they have on them, but no, you can feel free to touch them all you'd like and you won't get a wart.
Okay, good for our biology majors out there. Okay, do warts show any greater frequency in young people, or as you age and everything, do you develop maybe a tolerance or resistance to them?
That's a great question. Basically, warts are most common in young children. About 15% of kids will get a wart, in their childhood years, and the most common age where they get it is in the early teens, between 12 and 15 or so. And the reason for that is because children will tend to be doing more things with their hands where they will get small abrasions or hangnails. They'll pick their fingertips, they'll chew their nails, they'll get little tiny cuts, and warts can get in through the skin that way. The wart virus can get in and cause trouble. Whereas as we age, we tend to use our hands less maybe for those type of activities, and wash our hands more, and the viruses will stay at bay. Okay,
and then we talked about genital warts. Everybody has some sort of curiosity about those, just because it's a very, very sensitive topic in a very sensitive area. How does one contract genital warts, and how linked is it? And are there any other ways, I guess, besides STDs that you can get genital warts?
Right. So genital warts are transmitted sexually. You cannot have a wart on your hand and then transmit it to your private parts. That cannot happen. Okay. There are specific HPV types. There's about 2 or 3 types that are very common in the genital area. Those kind do not cause warts on your hands or face or anywhere else. So it's basically transmitted through sexual contact. Condoms don't completely protect people either. The other difficulty with genital warts is that not all of them can be seen. They can be dormant for years, months to years actually, before they erupt as a larger papule. This tiny little warts, you can't even see them. They're practically invisible.
Okay, now we are going to go to commercial, but I guess real quick, for people that have warts or they think they have warts, what is the best treatment for that? And we already talked, you shouldn't pop your pimples, you shouldn't try and squeeze your zits or anything like that. How about warts? How much more sensitive are they?
Well, depending on the location of the wart, basically what we're trying to do with any wart treatment is activate our own immune system so that it can see the wart virus and destroy it. If we do things like buy over-the-counter topical wart lotions, that might be a good start. Keep the wart covered with a Band-Aid. Try to live a healthful lifestyle. You can try that. As far as genital warts, they do require medical treatment, either topical lotions, or there's creams that you can use to help them go away, and it's very effective. They will go away. They may come back a bit, but they will go away.
Okay, well, tell you what, we have a bunch of questions from our Facebook fans and everything. You ready to do that?
Yes.
Okay, well, we will take a quick commercial break. We will be back in just a few seconds. The doctor is standing by, and we'll answer your questions about warts when KUAM News Extra continues.